Hi all, welcome back to my YouTube channel. So today's video is about EFA exit exam questions with answers. So before going to the video, please do like, share and subscribe to my channel. So let's go to the video. Question number 1. The emergency responder is one link in the chain of services known as the emergency crew care system, emergency medical service system, professional emergency care system. Option B, emergency medical service system is the correct answer. Question number 2. What does A stand for in the acronym DRABC? Option A, ambulance. Option B, alert. Option C, airway. Option C, airway is the correct answer. Question number 3. When caring for a victim who has an object impaled in their hand, you should Option A, remove the object, flush with cool water, transport it to hospital. Option B, immobilize the object by placing several dressings around it. Option C, break off where it sticks out and bandage injury. Option B, immobilize the object by placing several dressings around it is the correct answer. Question number 4. To reduce the risk of respiratory infection and pneumonia where medical care is delayed, responders should Option A, have the patient deeply handcuffed. Option B, provide the patient with adequate hydration. Option C, position the patient in position of comfort. Option A, have the patient deeply handcuffed is the correct answer. Question number 5. Which of the following is a sign of severe airway obstruction? Option A, forceful cough. Option B, wheezing. Option C, high-pitched inhalation. Option D, all of the above. Forceful cough, wheezing, high-pitched inhalation. The three answers are correct answers. All of them. Question number 6. What is the name of the type of stretcher often found on board? Option A, the canvas pole stretcher. Option B, the nail Robertson stretcher. Option C, the Solas stretcher. Option B, the nail Robertson stretcher is the correct answer. Question number 7. Which artery's pressure point is located on front of upper leg just below the middle of crease joint? Option A, radial artery. Option B, popliteal artery. Option B, C, femoral artery. Option C, femoral artery is the correct answer. Question number 8. When communicating with patients, Option A, stay at eye level and maintain eye contact. Option B, stay as close to the patient as possible. Option C, hide facts if situation is serious. Option A, stay at eye level and maintain eye contact is the correct answer. Question number 11. Your role in making the first aid successful. Your work activity includes 4 steps. Option A, elevate, identify, decide, execute. Option B, recognize, decide, call, care, protect. Option C, check, call, care, protect. Option B, recognize, decide, care, protect is the correct answer. Where does the partially digested food in liquid form goes after it leaves the stomach? Option A, small intestine. Option B, large intestine. Option C, medium intestine. Option A, small intestine is the correct answer. Question number 13. You have someone who is pale, sweating, forcefully trembling and acting aggressively. They appear drunk but do not smell of alcohol. What may be wrong with them? Option A, they are suffering from diabetic emergency. Option B, they are suffering from heart attack. Option C, they are suffering from stroke. Option A, they are suffering from diabetic emergency is the correct answer. Question number 14. Lung is an individual organ composed of tubular structures and alveoli bound together by fibrous connective tissues. Option A, true. Option B, false. The answer is false. Question number 15. Pelvic fracture can cause severe and even life-threatening bleeding into the Option A, pelvic areas. Option B, abdominal cavities. Option C, all of the above. Pelvic areas and abdominal cavities. Both are correct answers. Question number 16. On an infant, if you are the long rescuer, you should perform compressions. Option A, using 2 fingers just below the nipple line. Option B, using the heel of one hand just below the nipple line. Option C, using the heel of 2 hands just below the nipple line. Option A, using 2 fingers just below the nipple line is the correct answer. Question number 17. On an infant, where would you check the pulse? Option A, inside the wrist just above the hand. Option B, behind the kneecap. Option C, inside the arm between the elbow and shoulder. Option C, inside the arm between the elbow and shoulder is the correct answer. Question number 18. Tonals are special collection of lymphoid tissue. Our protective structures are located primarily at the entrances of the respiratory and digestive systems. Option A, true. Option B, false. The answer is true. Question number 19. A tissue is grouping of like cells working together. Option A, true. Option B, false. The answer is true. Question number 20. You discover a particle embedded in the casualty cornea. You should, option A, remove the particle with moist corner of a facial tissue or clean cloth. Option B, cover the face and transport casualty to medical help. Option C, cover the eye and transport the casualty to medical help. Option C, cover the eye and transport the casualty to medical help. Question number 21. Sir, tissue make up organs and organ is a structure performing a particular function. Option A, true. Option B, false. The answer is true. Question number 22. After an extremity fracture has been immobilized, the responder should check for circulation. Option A, in the injured limb only distal to the injury. Option B, at the site of the fracture. Option C, distal to the injury. Option C, distal to the injury. Question number 23. When performing adult CPR, you give option A, 2 slow breaths and 10 chest compressions. Option B, 2 slow breaths and 20 chest compressions. Option C, 2 slow breaths and 30 chest compressions. Option C, 2 slow breaths and 30 chest compressions is the correct answer. Question number 24. What method of handling you give if victim is unconscious? Option A, fireman lift. Option B, simple force and aft carry. Option C, all of the above. Fireman lift and simple force and aft carry both are correct answers. So all of the above. Question number 25. The heart produces motive force to drive the blood. It's located just below the diagram. Extending slightly to the right, the size of heart of an average individual is weighing half kg. Option A, true. Option B, false. The answer is false. Question number 26. When caring for a victim who has an object impaled in their hand, you should, option A, remove the object, flush with cool water and transport to the hospital. Option B, immobilize by placing several dressings around it. Option C, none of the above. Option B, immobilize the object by placing several dressings around it is the correct answer. Question number 27. A person indicates that he has been bitten by a snake. What would you do? Option A, wash the wound, keep the injured area lower than the heart, get professional medical care within 30 minutes. Option B, apply ice to the wound. Option C, none of the above. Option A, wash the wound, keep the injured area lower than the heart, get professional medical care within 30 minutes is the correct answer. Question number 28. What should you do if you think the victim has serious internal bleeding? Option A, apply heat to the injured area. Option B, give fluids to replace a blood loss. Option C, call for medical assistance as quickly as possible. Option C, call for the medical assistance as quickly as possible. Question number 29. Answer. To treat a first degree burn what should you do? Apply a good quality burn cream or ointment. Option B, apply hot water. Option C, apply cool running water. There is little or no pain remaining. Option C, apply cool running water until there is no pain or little. Question number 13. An accepted treatment for nosebleed. Tightly squeeze the nostrils. Option B, have the victim lean forward and apply heat if available. Option C, have the victim lean forward and apply gentle pressure on the nostril. Apply cold towels. Option C. Have the victim lean forward and apply gentle pressure on the nostril and apply cold towels is the correct.